Welcome to our workshop supporting youth well-being, preventing and responding to child sexual abuse through leadership. My name is Sophia, and I will be your host for this session. We'll have about 50 minutes from 1 to 1:50 p.m. Central Time and a 10-minute break in between sessions. And I'd like to go over some housekeeping items before we start. So the first is that this is a safe and supportive space. Second, please help us maintain a respectful and inclusive environment. Third, please use the chat function in Zoom to interact with other attendees. And you can also use the chat box for questions for the presenter. And lastly, we will have a couple of forms to complete. So if you registered for a continuing education credit or a CEU, please be sure to fill out the sign-in sheet and this CEU form that is in the chat. We'll also post a link for the workshop evaluation in the chat towards the end of our session because we value your feedback and we want to make sure that we continue improving our offerings. So without further ado, please join me in welcoming our presenter, Crispin Ketelet-Monteleone. Thank you.
Thank you so much. It's a joy to be here. My name is Crispin. I'm the Creative Director of Training and Content Development of the Beatrice programs. And my organization, just to give you a little bit of background, teaches organizations and individuals how to put systems in place to protect the vulnerable, with a focus on preventing and responding to child sexual abuse and other types of trauma that can occur. So to date, over the past 20 years or so, we've trained at least 6 million adults in initial training, and then all of those adults have gone through follow-up training over the years, so additional ongoing training to help them to be better and more protective adults. So some of the things that we've learned through our program, we're going to be kind of talking about that today. And just to give you a little bit more of a sociocultural backdrop for this presentation, it's addressing our immediate physical and social and cultural settings in which child abuse can happen or develop, and then what we can all do about it. So, we're really hungry. All of us are really hungry for really good leadership, for advocates, and for ambassadors, both comprised of adults and also children. So it's very good that we're here, because we're going to learn about how to be safer, how to be better, how to really attend to the needs of our different cultures and our different communities. So one of the most pervasive and deleterious public health issues that exist in our society is child sexual abuse. So I'm going to refer to that often as CSA, but it's just something that is so pervasive. It's very complex. It negatively affects every culture, every community, and every demographic, including every socioeconomic level. So it's really pervasive and it's really prevalent. And it's actually very salient to this particular conference of Young Minds Matter, because different ethnic and cultural groups, for example, have different rates of reporting the abuse that happens to them. So what we can find in the research and the literature and then also reports is that non-white and Hispanic children appear more often through child protective services, through the calls, through the services, and they appear at higher rates compared to white children for child sexual abuse in particular. And unfortunately, it can be really devastating for different cultures, but when people of culture go through child protective services, to the extent that they're actually removed from the family, they're less likely to be reintegrated back into their families, and they're more likely to remain in foster care for the duration of their childhood. So that's really problematic. We know that that can really increase negative outcomes for that person's future, for their childhood, and also for their adulthood. And it can just really lead to negative outcomes. So we also can find in different literature and different research and through different reports that, persons of color and different ethnicities and different cultures are less likely to communicate. They're less willing to communicate about abuse. And most of that is really to protect that and preserve that family unit. So it's a protective measure, but it doesn't necessarily help the outcome for that child because abuse is still occurring, right? So what we're finding is that there's a vested interest for every single one of us who are here to have motivation to do everything that we can within our respective cultures, and also working together to prevent abuse, right? And then also stop it from continuing, right? It can happen now, it can be happening at the moment, and it might happen in the future. So we have to be aware of certain things that we can tangibly do to prevent it and to respond to stop it. So we know that we can mitigate a lot of this. We know that we can prevent a lot of this and create better public health outcomes. So we're going to talk about that, right? It's a multifaceted approach to prevent it in the first place and stop it from continuing. And then also to put supportive measures in place for our victim survivors, for their healing, and also for restorative justice. So the best way that we can do this is to create preventative systems. However, we have to think about how to respond to it too. So let's start. Let's break it down. We're going to do several things in this presentation. We're going to unpack some key concepts. We're going to address those cultural barriers to disclosures and also what increases children's vulnerability. We're going to determine the different responsibility that we each have. What's the child's responsibility? And I'm going to give you a hint. They have none, right? It's all on us. It's all our responsibility to protect them and to create these systems. They can help us, but it's not their responsibility. We're going to talk about our personal behavior and the impact, right? The impact of creating boundaries, of upholding boundaries, of diminishing boundaries, and how that all impacts this phenomenon. We're going to talk about game changer advocacy and what we can each do, right? For youth and with youth, right? And then we're going to talk about when we need to seek help from professionals and how to do that. So in 1998, there was a Keystone study. It was a really good study, and it addressed, in the late 90s, these researchers conducted this study of 17,000 adults that we reference now as the original adverse childhood experience, or the ACE study. And that was studied, all of that information was studied to understand the relationship between adverse childhood events and adult health. So they looked at these things called ACEs, right? The adverse childhood experiences. And all of that really revolutionized the way that we think about trauma and we think about adverse childhood experiences and adversity and its relationship to physical, emotional, mental, and physical health. So what's an ACE? An ACE is a frightening, dangerous, or a violent experience that poses a threat to a child's life or their bodily integrity. So I'm going to show you a list of them. And this list has been expanded over the years from the original ACE because there's been robust, beautiful research on different ACEs and what they are and how they impact well-being and public health. We're going to focus on sexual abuse, but I'm going to just give you an information about all of them. So, an ACE could be, a child experiencing neglect from a caregiver. It could be the loss of a loved one. It could be a serious accident or a life-threatening illness for themselves or someone that they love or know. It could be a disaster like terrorism or a natural disaster. It could be war or a refugee experience. It could be having someone be incarcerated, having their parents be divorced, right? It can also be sexual abuse. So when we're looking at the information that they found in all of these different studies, in the initial study and then all of the future ones as well, or the ones that follow that original study, I'm just going to summarize what we see here. But trauma and adversity occur together, and they can affect anyone. So no one is really immune from adversity or from trauma. The results also found that an ACE, an adverse childhood experience, so something that happens to children, is something that is common, right? It affects the majority of children, as many as 2 out of 3. We also found through the research and through all of the data that children experience polyvictimization. So, and that it depends, but as many as 25% of children can have more than four childhood experiences, some adverse childhood experiences in their childhood. And the more trauma and adversity that's experienced, the more risk is associated with those outcomes. So it affects them not only in their development, but also physically, emotionally, and mentally into their development, into their adulthood. So the biggest takeaway really is that there's a very strong connection between early experiences in childhood and optimal health, wellness, and life opportunities across adulthood, across your life course. I mean, even children who only experienced one ACE had immediate and long-term impacts, including disrupted neurological development, disrupted physiological development with early onset of puberty, increased negative coping behaviors, increased health risk, increased chance of sexual violence. So we're going to look at one of those in particular, and which is child sexual abuse. We're going to look at that, and we're going to kind of look at the data and look at how that ACE, that adverse childhood experience, really has impacted children and adults in our society. So we're going to look at the numbers real quick, the prevalence. It's really difficult for experts to find one prevalence rate. So you see a lot of different studies, and a lot of our data is coming from meta-analysis from these different studies. And this particular data is averaging adult perpetrated contact child sexual abuse and peer perpetrated contact child sexual abuse. So that means that the number is a little bit different depending on whether adults are the abusers or children are the abusers, right? But if you average those together and you're separating out by gender, and you're looking at contact specific. So we're talking about there was physical touch there of genitalia. So either the child was forced to touch the genitalia of the adult, or the adult or other child touched the genitalia of that child. So bare minimum, there's physical touch. There's more than likely much more than simply physical touch, but that's contrasted with non-contact sexual abuse, which would be forcing a child to watch sexual intercourse, forcing them to be present while a sexual act is committed, for example, but not necessarily touch. So when we're looking at an average of adult perpetrated contact CSA with peer perpetrated contact CSA and separating out by gender, it's about 1 in 5 females is sexually abused before she's an adult, and about 1 in 20 males is sexually abused before he is an adult. You're going to see different data for this, depending on the research, depending on the study. You're going to see sometimes 1 in 4 girls, 1 in 6 boys, 1 in 5 girls, 1 in 10 boys. And it really just depends on how they're evaluating that material. But this is a really good, solid number here. And if you just wanted to average everything together, it would be appropriate to say that it's around 1 in 10 children. So around 1 in 10 children is sexually abused before they become an adult. That just gives us kind of a starting point to understand how prevalent this is in our communities. So when we're looking at the ACE of child sexual abuse, all of the experts agree that it's a public health issue, right? All of the research is saying the same thing. And it doesn't necessarily matter the nuances of how many children are abused, but all of the research is saying the same thing. So here's what it's saying for the ACE, right? So when we narrow and just look at child sexual abuse, we can see that the trauma of child sexual abuse causes acute psychological distress and physiological stress. And, for example, there's increased impact on negative outcomes. Like there's less cognitive competence, for example. There's less social competence. There's less self-esteem. There's more issues with control. There are more psychopathologies, right, for children that have been sexually abused. There's more disassociation, depression, PTSD, anxiety, hypersexuality, and things like bipolar disorder, things of that nature. There's increased risks of engaging in unhealthy and unsafe behaviors. So substance abuse, risky sexual behaviors. That means that, a child might participate after they've been sexually abused. They might participate in risky behaviors like having multiple partners, increasing their risk of receiving a sexually transmitted illness, for example. There's more propensity to attempt suicide. There's also physiological effects. There's earlier onset of puberty for those children that have been sexually abused, depending on the actual time frame of which they were abused. There's cognitive deficits. There's chronic stress that can affect the brain development, the neurological development. There is increased chance of obesity, heart disease, cancer, chronic illnesses, and there's actually reduced life expectancy. There's also, and this is the single most predictor of future sexual violence, when a child has been sexually abused, they are much more likely to be sexually abused later on in life, in their childhood, and then also in their adult life as well. And there's also lower educational attainment, poor academic performance, teen pregnancy and motherhood, lower socioeconomic levels, for example. And these are all kind of examples of what happens after somebody has been sexually abused. So sometimes people will say, we've trained 6 million adults, right? So we have a lot of experience dealing with the public perception and individual responsibility in dealing with child sexual abuse, right? So a lot of these adults will say something like, um, and I want to, this is a disclaimer because this is what other people have said, and we're going to talk about that. So people will say, well, these children are damaged, and these children who have been sexually abused, they're never going to recover, and their innocence has been taken from them, and there is nothing that they can do to get it back, and that they're other than the rest of us, right? So that's a horrible thing to think about and a horrible thing to say, really. But we can understand why people might think that. And I just want to say a couple of things here. So first, a child's ability to be resilient over what's happened to them can decrease with each ACE that they encounter. But I want to say this really, really clearly. While there are long and far-reaching effects of child sexual abuse, right, and negative effects of child sexual abuse, every person is different, but healing certainly is possible. And healing is really affected by certain items, right? So the degree of trauma and the ability and the pace of healing depends on certain things. So that could be the type of the abuse, right? So was it contact or was it non-contact? What was the degree of that contact? What was the level of violation? How intimate was it, for example? What was the duration? For how long did that abuse occur, right? What was the frequency? How often did the abuse occur? Was it one time? Was it several times? Was it 3 times a week? Was it several times a day, right? What was the relationship to the abuser? So in other words, what was the level of that betrayal? Was there physical force or threats involved? Usually when we're talking about child sexual abuse, that isn't the case because of the level of grooming and manipulation that can occur. But it can happen. And if it does happen, then that increases the ACE score, right? The threat of violence or the actual violence. Also the age of onset. Sometimes people will say, well, if a child is very young, then they're less likely to be affected by sexual abuse because they won't remember anything. And I just want to let you know that it doesn't necessarily matter the age of a child. I mean, it can impact things, right? But we shouldn't assume that because somebody is very young when they are sexually abused, that they won't necessarily remember it, because you don't have to remember abuse for the trauma to harm your body and for there to be years of recuperation that you have to go through and recovery that you have to go through to be able to thrive, for example. So what did we learn through research? What have we learned? We've learned that even though all of these factors can impact the degree of trauma and the ability to heal, the most important thing is the concept of support. So what happens, for example, when a child tries to talk about it, or if they're able to kind of give clues that abuse is happening, or if they're able to communicate about it, what happens? What's happening in that vacuum? For example, does the child have someone in their life who's accusing them of lying? Does the child have somebody who says, don't talk about your uncle like that? Or do they say, God is not going to forgive you for lying and for making up such horrible things? Or do they say something like, this is what it means to be a woman. We have to bear this and be strong. Or in our culture, we have to bear this. We have to overcome this type of adversity. Like, what happens, right? So did they have somebody who listened to them? And did they have someone who believed them? And did they have somebody who was willing to report that abuse? And did they have somebody who was willing to mobilize professional therapeutic support? And those children that had that support, right? Whether it's within their family or outside of their family, some advocate outside of their family, those children fare much better than the children who don't have that type of support system. So the takeaway for all of us is that it teaches us that we have really great and important power in the healing journey for survivors. And it starts at the beginning when the child is ready to disclose, when they talk about it. So whether we interact with children in their childhood or whether we interact with them later on as adults, we have great power in that journey of recuperation, of healing. So what can we do? There's a lot of, debate and questions about what we can do. And I know that it's probably been very difficult to hear about, the ACE, the adverse childhood experience of child sexual abuse, and all of those poor outcomes and the challenge that children have ahead of them when they've been sexually abused, right? Now, there is good news here, because even though trauma and adversity are common amongst children, and there can be long and far reaching effects, negative effects of child sexual abuse, research is also showing that prevention is possible. And we can not only prevent it from happening, but we can stop it from continuing. So we have to deepen our understanding of trauma and adversity, right? Which is why we went through the beginning portions of this session. We have to learn how to pool our resources to develop strategies for proper response. And we have to figure out how we can prevent this before it can convert to those outcomes, right? Before we want to try to prevent some of those leading causes of disease and disability and death in our country. So we can do things tangibly together, but we have to do it together. We can do it individually, but it works most effectively when we're all doing it collectively together and working together. So what can we prevent and mitigate? We can prevent and mitigate poor outcomes for children who have already experienced abuse. We can stop it from happening in the first place, and we can address current and future CSA from happening. And these are the ways that we do it, right? So we have to focus on primary prevention, which is eliminating the possibility before it can even start. We have to create situations where children can thrive and reach their full potential, which means we have to partner with them to be change ambassadors. We have to invest. Sometimes there's a financial investment. Sometimes there's an investment of time and energy, right? And talent, and investing in systems that help us to prioritize healthy, safe, and stable and nurturing relationships and environments for children. And sometimes there's a expenditure of our own energy to do that. And we have to change our behavior. And that's hard to do. We have to be able to objectively look at our behavior, which is very subjective. And we have to be able to identify the behavior that we're doing that's problematic, and change that for the good of children, right? And then all of this is ultimately strengthening the public health impact. So whether you are a volunteer in a youth serving organization, whether you are a mentor, whether you are an employee, a sibling, a parent, even if you don't have children at all, right? You matter. Like, there are things that you can do to support healthy and good childhoods. And what we found in the research is that experiencing a positive relationship with an adult helps children to overcome and effectively manage their adverse childhood experience of child sexual abuse. So it's not just you can do this on a one-to-one micro level, right? You can do this and that would be sufficient if you could even just help one child through this. But you can also do this through more of like a mezzo level, right? So you can do this in your own specific community, and then you can also work on a macro level as well. So in order to do this, right, we have to commit to being safe adults. So how do we do it? Like, what are some things? So we're going to kind of go through some different things that we have to be aware of to help us be the best possible safe adults for these children. And we have to think about our personal responsibility in partnering with youth for their safety, and really shifting the narrative when it comes to child sexual abuse, because it's a subject for almost every culture that's taboo. We don't want to talk about it. We don't want to deal with it. So we have to shift that, right? So first and foremost, consider your legacy effect, right? So your actions are either going to make children safer or more vulnerable. It's one or the other. It can't necessarily be both. So you have to make the choice. Are you going to commit to helping to ensure that children are safer at all times? Or are you going to not necessarily think about how all fits together? And are you going to put them in situations where they're more vulnerable? You got to forgive this little typo here. So we have to learn about disclosures, right? We have to think about our own behavior. We have to think about how we might be conditioning children with our own behavior, right? So what's an example of that? An example is when, let's say that we're at a family reunion, right? And we are responsible for children, and we're telling children that they have to give us a hug, right? To greet us, that they have to give us a kiss on the cheek, or that they have to go and give their grandmother a hug, even when that child is saying they don't want to. So when we say, well, you have to go over there and give your aunt a hug or a kiss, or you have to go and give your grandmother a hug, or you need to come over here and give me a hug. And when we act offended when they don't do those things, when we get angry with them, or we allow other people, people can show those emotions, but when we force children to go and give these types of hugs and this affection, well, that's telling children even from very young ages that their personal boundaries are less important, and that somebody else's desire for affection from that child's body is more important. So we're telling them that their personal physical boundaries don't matter. And what's more important is somebody else's desire for their body, or for whatever it is that their body can give. And that's not good, right? That's a very specific in small way that we can kind of fortify children's boundaries from the very beginning and give them more power. We have to learn about disclosures, test balloon statements. We have to learn about and reflect those elements in our own specific cultures and our wider cultures that impact CSA and also impact children's ability to disclose. And we have to start thinking about our reactions right now. So I want you to think about, if you are trusted, and it doesn't, you may not necessarily be actively involved in any child's life. They may just see you as a very stable person on the periphery, and they might trust you with a disclosure because they see you and you might be the most stable person in their life, right? So if you have the honor of being able to help a child with their disclosure, right? They trust you with something so monumental as a disclosure. You have to think about what that's going to look like. What is your face going to show? What are you going to say with your words? Are you going to look really stern? Are you going to look angry? Are you going to look upset? Are you going to accuse them of things? Are you going to say, what's your gut reaction going to be? And I want you to be prepared for that and think about it now, because the most minute change in your facial expression could potentially stop a child from disclosing. So we have to think about how we're going to calm our reaction when they come to us, not necessarily if, but when. And then we have to think about ways that we're going to advocate for the youth, to the youth, for the youth, right? Or with the youth. So here's some foundational concepts that we're going to review. Look, upholding the boundary, the proper boundary, is always the job of the person with the greater threshold of responsibility. And that is always that of the adult who has a position of power simply by being an adult. We have to help children. We have to say it to ourselves. We have to help children understand that they're allowed to say no, especially when it comes to their safety. Some children don't know that they're allowed to say no, right? Saying no is placing a boundary, and we have to teach children how to say no for their own safety, and that it's okay, and that we will respect their no, right? We have to help children to know that boundaries are good and they're acceptable for healthy relationships, and that caring, safe, and responsible adults will personally accept children's no graciously. And that, the child can have alternative ways of saying no. They can show it through their body, they can show it through their words, they can show it through their body language, right? So caring, safe, responsible adults are going to always prioritize safety. And the role of us as caring, safe, and responsible adults is to meet the safety needs of the child, respect their boundaries, and also the boundaries of that child's parents, for example. We need to know that abuse can happen anywhere. It happens in all those demographics that we mentioned earlier. In most abuse, as much as 90% of abuse is occurring where the abuser is known and trusted, not just by that child, but usually by the family as well. Children cannot choose their own victimization. This is a myth that we constantly have to break down, right? So they aren't asking to be victimized if they're wearing revealing clothing, right? If they're using specific language, if they act in a promiscuous way. In other words, children are never responsible for the abuse that happens to them. And that's like one of those things that we have to not only understand ourselves, but we have to communicate to them too. So if a child is ever abused, it's never their fault, ever. Full stop. Other facts that we need to know, foundational concepts. We can't always rely on children's behavioral indicators to identify or discover that sexual abuse is happening. A minor's ability to communicate about the abuse or to show, like, sometimes their behavior is a little bit confusing. So we can't rely on that, right? It's extremely challenging for children, for survivors, to be able to disclose about the sexual abuse that's happened to them. The trauma that they've experienced can lead to really harmful factors that delay their disclosure. And it's very difficult for them to talk about it. Many children never disclose about the abuse that happened to them, even after they become adults. The average age by which someone discloses their abuse is 52 years of age. 52. That's years after the abuse has happened. So delayed disclosure by adults is really, really common. Survivors can wait years. The average age right now that a child is disclosing their abuse is after 5 years, right? If they do talk about it, they usually don't talk about it to a parent. They usually talk about it to somebody else, and that other person is typically a peer. And peers don't then get it to an adult because peers don't know what to do with it because they haven't been educated, right? It's not their job to protect their friends, but they can help, right? So this is really important. Those children who do self-disclose help with that discovery, and they have much more positive outcomes. And it gives safe adults the ability to halt the abuse and provide avenues to address those immediate effects of abuse through medical and therapeutic interventions, and then to prevent future abuse from happening as well. So we have a vested interest in this entire process, right? As we're getting into this role, this tangible role of being a safe adult, you might observe behavior that causes you to have a reasonable suspicion or belief that abuse is happening, right? That a child has been victimized, or they might talk about it themselves, right? Through test balloon statements. They might do it accidentally, or they might do it directly. So you might need to take this information that you hear or see, or observe, or that's concerning to you, and you might need to report that to Child Protective Services, and we want to be prepared for that. Here are some of those behavioral cues, those concerning behavioral cues that children might exhibit when they're being sexually abused. Some children don't exhibit any behavioral cues. What we want to really pay attention to are sudden changes in behavior. If they really like something and then suddenly they don't like it anymore. They love going to soccer, suddenly they don't want anything to do with soccer, they don't want anything to do with their coach, right? Sometimes these changes can be negative, sometimes they can appear to be positive. So somebody can suddenly have really good grades because they don't want to go to tutoring anymore, right? They don't want to go back to that place where they're being abused. Sometimes they say, if I had been a better student, then this wouldn't have happened, right? So you'll see a lot of different behavioral cues that can happen here. And this is just kind of an example of several of them. Now, if they're exhibiting one or more of these behavioral cues, it doesn't necessarily mean that they're being abused, but the important key is that we need to understand the value of consistent communication. And if something is amiss or if we're concerned, then we need to have communication. We need to talk to them about it. So this is what a disclosure is, right? In the context for us, a disclosure is when a victim survivor communicates or attempts to communicate about the experience of sexual abuse, whether it's to a peer friend, to an adult, or even to the authorities. So it can also include a situation that a friend is experiencing, right? Or they might try to tell you about it in a story. It can be direct or indirect. They can send up test balloons to evaluate how you're going to handle it, right? So if they feel like you're not going to listen, or if you are going to judge them, or if your face is showing that there's judgment or fear or worry or anger, then they're going to stop and they're going to recant, right? They might do this in person, they might do it in a group setting, and they might do it online, right? Or electronically. And it might happen right after you start teaching them about their boundaries and about their rights as children, as people. So what we're going to do now is we're going to talk about disclosures and how you can navigate through them. As children are considering disclosing, right, there's a lot of barriers to their reporting. And I'm going to highlight a few of these because the more we understand these barriers, the more we can put systems in place to combat them. So there's a lot of situations where children may lack the understanding that they've been abused, right? They might be afraid that that they're going to be ignored. They might be fearful that someone else will prioritize a relationship with an adult. So they don't want to talk about that because they're afraid that somebody will prioritize the adult relationship over the relationship they have with the child. They're fearful that they're not going to be believed. And there's lots of things that we do as adults unwittingly, not even realizing it, that cause children to recant their honest account of abuse. Now, it's really important that we recognize that when children disclose about abuse, in that initial disclosure, there's a 95% chance that they're telling the truth and only a 5% chance they're intentionally lying about it. So if we hear it, we have to act on it, right? We can't be questioning whether or not it's true because there's a 95% chance per the research that what they're saying is true when it comes to child sexual abuse. So we also have to think about cultures and ethnicities. And while we celebrate the richness of our respective cultures and ethnicities, there are elements between the two that make children more vulnerable to child sexual abuse. So these cultural norms, before I even talk about that, when we're talking about culture, this is pretty open-ended because different research identifies culture differently, right? So whether, this could be your own culture, right? Your own personal response or nuanced approach to talking about these things. It could be the membership that you have to your particular family or to your ethnic group, for example. Or it could be what's been enculturated for you within your surroundings, right? Your work environment, your city, your state, your country. So all these things are different levels of culture that impact child sexual abuse. And the reality is that while we do celebrate the richness of our respective cultures, there are things that can make children more vulnerable. So a child's membership within a particular culture may decrease their ability or their opportunities to communicate about abuse. It can increase their disclosure delay, well into their adulthood, right? And if that child can overcome their ability to communicate, um, it just takes a really long time. And ultimately, all of this increases their vulnerability at that time of the abuse and in the future. Because if a child is abused one time, they're more likely to be abused again in their childhood and then also in their adulthood. And the primary reason for that is because different cultural and ethnic aspects may place the needs of a family and a community above the needs or welfare of the individual child. And the decision, and what's interesting about all of this is that the decision to, like, whether or not we report about abuse that's happening in our surroundings is never an individual decision. It's always impacted and made in the context of a group in our culture. So this is a huge invitation for us to consider those elements within our own individual and personal cultures, within our different ethnicities, within our family of origin, within our greater community of all of those things that might make it more difficult for children to talk about the abuse that's happening to them, or that might happen to them, for example. So here's some examples of that. I know this is small print, right? I wanted to get all of this on one slide for you. I'm going to read these out to you because I know it might be difficult to see, but those things that make it harder for children to disclose, and those situations that make adults in different cultures prioritize something other than the child are the following, right? So sometimes one of those cultural aspects might be denial that it's even a problem, that the problem could happen, that it could happen here, that could happen to our family, that could happen to this child, for example, that a particular person could be abused, and that the particular adult that you're talking to, that their judgment could be so wrong that they could have trusted that other adult in their life, right? So there's a lot of denial here that happens with child sexual abuse. There's a lot of rejecting personal responsibility. And there's a lot of emphasis on protecting something other than the child. So you're protecting your own fears, right? Your own concerns. You're prioritizing those things. You're protecting a certain person in your life that is not the child. You are protecting the nuclear unit, right? The nuclear cell, or the family unit, because you're afraid of what might happen to that cell. You are prioritizing an organization because the values of the organization are more important to you. You might, or a person might view the role or status of woman and the patriarchy negatively or positively. For example, women might be seen as less than. Women might not have equal rights in that particular culture. Women might be taught that we need to bear injustice and abuse as their due as women, right? So they are taught to tolerate certain abusive behaviors because that's what is required of women. That's what that culture might teach them. Men might be taught that they have to be tough at all costs, right? So to be abused is scandalous and not to even like, and it's like revoking their man card, for example. I've heard that before. So you might also see situations where there are really strong concepts of honor and respect in that particular culture. So there's prioritization of respect for elders. So if an elder is abusing, well, you can't go against that elder, for example. Children might be seen and not heard. That might be the preference. There might be grave circumstances that could occur if a child speaks up against an adult. And how does that culture handle scandal, right? There's concepts of shame that we have to think about. So how does your culture address modesty? What are the taboo subjects? What brings shame to your culture, right? What are the sexual scripts of your culture? So girls and boys may be taught that men can't control themselves when it comes to sex. They might be taught that it's the female's job to protect her virginity or her purity. And if she doesn't protect it, well, then she's soiled. That's what girls are taught, or they weren't pure enough, right? There might be an emphasis in that culture on purity and virginity. Girls may no longer be eligible to marry if they're no longer virgins, even if it was a result of CSA. There might be obligatory violence where children will tell their kids not to talk about abuse because they don't want to trigger that obligatory violence that could remove certain people from the family. And there might be a lack of recognition of abuse, right? Lack of education, unwillingness to see that abuse is happening or the point of view of the child. There might be a personal history of abuse. There might be concepts of affection or of affection where the culture might prioritize that affection over the wants and needs of a child. And there might be, poor boundaries. So boundaries are really game changers for all of us, because once we teach boundaries, all healthy relationships have them, and it's never too late to reset them, right? Children need this, absolutely, because we're not teaching boundaries in our culture right now. So we have to really put them into place. And once we teach them and model boundaries, children can begin to be those agents of change for themselves. amongst their peers, and even they have the courage to even speak to adults about their boundaries, right? And standing up for themselves. They're more willing when they have a healthy understanding of boundaries. They're more willing to stand up for healthy relationships, to recognize warning signs of unhealthy relationships, have the words to speak up for themselves. And this is a must have for any of us as leaders to be able to incorporate healthy boundaries into our own behavior and to prioritize them. So, even small boundary, they're progressive, right? They're cumulative boundary violations. And they almost always, in cases of child sexual abuse, there was a history of inappropriate boundaries, right? Of boundary violations. So your modeling of appropriate behavior, appropriate boundaries is really significant because you are either going to help or you're going to hurt, right? You're going to either make them safer or make them more vulnerable. So here's the optimal conditions by which children disclose, right? Being asked direct questions about whether they've been violated, talking about their general welfare with children in their educational and social environment. And when a child does attempt to say something that's problematic, when the adult follows up and says, well, tell me more about that, right? I'm going to keep moving forward because we want to make sure that we have enough time here. Okay, so here are some examples of those test balloon statements. There's statements that are testing the water to see what happens. And if adult doesn't really address them, if adult ignores them, if adult shuts it down, which is the common reaction, adults typically shut down these test statements, these test balloon statements, then it's a missed opportunity for disclosure. And disclosures are really important because it's one of those ways that we can really tell that abuse is happening, right? And stop it from continuing because we can't count on the children's behavior, right? But we can count on their disclosures. So here's examples of those test balloon statements. I don't like staying with this person. Do I have to do this? Do I have to go to work? Do you have to leave me? My cousin hurts me sometimes. I couldn't sleep last night at the slumber party. I don't like being with this person, right? These are all really good examples of test balloon statements. And here's ways that we can continue that conversation with them. And the best way to do it, I'm giving you a whole bunch of them in case you want to look at these slides later. But the best thing that we can do is, okay, tell me more about that, right? Just a simple pause. Tell me more about that. And then here are some other ones that you can take a look at. These are really helpful to keep that conversation going. And it's not necessarily about abuse. It could be something problematic, but getting that conversation to continue despite our busyness, despite our stressors, despite what's going on in our own lives, right? Getting children to talk about this helps with those ACEs. It helps those outcomes. It prevents abuse from happening in the first place, and it stops it from continuing. It's an opportunity to do that. And it tells that child that you're in their corner and that they can count on you to be there for them. So here's some examples. Our reactions really matter, right? We want to be patient. We're calm. We're not tense. We tell them we believe them. And we do the necessary actions after the fact, which is to report when we suspect that abuse is happening, which means that it occurs to us that it could be happening. So it's an opportunity, right? We're always engaging in active listening, and we're allowing children to engage at their own pace. So you shouldn't take notes during the disclosure, and you shouldn't promise confidentiality to a child, right? Because you might have to share that information that they've given to you. You might have to share that with law enforcement or with Child Protective Services for their welfare. So we can't promise confidentiality, and we should wait to take notes until later. So any disclosures by youth about child sexual abuse, about physical abuse, about emotional abuse or neglect is something that we would have to report, right? And anything that gives us a belief that a child could be sexually abused. We always err on the side of caution to protect children. And then if there's some type of inappropriate behavior, right, then that's something that we would have to communicate to our organizations, right? If we observe inappropriate behavior, if a child communicates inappropriate behavior, that's not actual abuse, it's not a suspicion of abuse, but it's against the rules, right? It's contrary to the code of conduct, then we absolutely need to bring that to the notice of somebody who's in a leadership position at our organization. So here's some frequently asked questions that we receive. Keep your physical affection to a minimum, right? Children need physical affection, but during disclosures, kind of keep your hands to yourself unless they ask for a hug, and then you can give them an appropriate hug, for example. You should report and then communicate with your supervisors if it's having to do with somebody at your organization. You do not ever need to talk to the person with whom the child spoke about, because that might impede the investigation, and it might cause greater problems for the child. You should never share your own story of abuse, because then it makes it about you, right? This is about the child. You would never want to rely on sex offender websites for protection for a variety of reasons. It could be one thing that you can do, but it can't be your fail-safe, because then we're focusing and fixating on one house, not all the other houses where there could be problematic, you know, behavior or situations. And if the child asks you what you would do if they had been abused, like a hypothetical situation, well, then you wouldn't say that you would, kill someone, or like that person would never be alive, moving forward. But you would say that you would do everything in your power to help that child and get them what they need, and that you would believe them, and that you would support them, right? Those are the things that you would say. So, just in conclusion here, as we draw to a close, we never know who a child is going to see as their protector. Regardless of our individual roles and families and communities, we don't have to be parents to implement all of this, right? But you just don't know who that child is going to see as a stable person in their life, right? So you might be the only one that they're willing to reach out to. So you matter, right? Obviously, you matter. Children need you, right? They need to be surrounded by safe people and safe environments, so that people who do have bad intentions and who have inappropriate behavior can't break through the walls of protection that we have for them, right? And alternatively, if a child does experience abuse, they need to know that they have a safe place to go, and a trusted adult like you who's in their corner, who will guide them and help them. They need people like us, like you and like me, who are willing to inform themselves about how they can react and respond to unsafe behaviors and potentially abusive situations. They need people who are willing to broach these difficult subjects, right? To ask them, how are you doing? Has anybody ever bothered you? Do you feel unsafe in this situation? What's the best thing about being with this person? What's the worst thing about being with this person, right? What's the worst thing about being in this situation? It's like these different questions that can really initiate a conversation and keep the conversation going. They need safe people and safe places to go. And you all are those people, right? You are a safe person. You are a safe, responsible, caring adult when you prioritize safety. So I just want to say thank you to all of you for even being here and doing what you're doing, because you're allowing children, by like considering this and by changing our behavior, by really thinking about it and setting up these systems, you're helping children to grow. You're creating systems by strengthening your own knowledge and your own skill set, so as to be a better conduit of hope to youth in our care. And by doing that, like when a child has been sexually abused, there is generational consequences to this, right? So when we think about like the maternal line, when a child has been sexually abused, it's called her generation 1. When she grows to become an adult and she has her own child, that's generation 2. Her child is more likely to be sexually abused because of the mother's sexual abuse. Not that the mother is abusing, that's very rare. But because of the circumstances that surround the mother's abuse, it makes it more likely that her own daughter is going to be sexually abused. And not only that, because of that mother's sexual abuse, right? The abuse that happened to the mother in her childhood, when she becomes a grandmother. So generation 1 becomes a grandmother. Generation 2 is a mother, right? And then generation 3 is the granddaughter. The granddaughter is more likely to be sexually abused because of the abuse that happened to her grandmother, because of the circumstances that filtered down. So we need to break that cycle, right? We absolutely need to break that cycle and put systems in place. We need to be conduits of hope. We need to know how to break these cycles, because children are counting on us, right? And by doing that, this is when we're talking about like our legacy effect, right? By breaking these different systems and by helping people to understand appropriate boundaries, appropriate behavior, by sharing our knowledge with other people, then when children leave our care and go elsewhere, that bad behavior sticks out like a sore thumb. And they know how to recognize it better. They know how to come back to us and talk to us about it. And they know how to model those behaviors, those appropriate behaviors, to other children, right, in their purview. And then when they grow, they have those boundaries in place and they can model behaviors, appropriate behaviors for children in their care too. So there are generational consequences to abuse, and there are generational consequences to the things that we're doing, positive generational consequences to the things that we're doing too. So I thank you and I applaud you for being here, because what we're doing can make a tremendous difference to public health and to these more positive outcomes for children. I'm just going to see if I have any questions here. Let's see here, Q&A. Can it be proved that healing is possible, or is it that we teach the children skills to cope with their trauma and build their resilience? Well, proving things is very difficult, but I can give you an example, and it's all very much anecdotal, but at the same time, there are a lot of systems in place to provide measures of support for victims. So healing can be possible. It's very individualized, and it depends on your support. And early intervention is always the best, right? Um, but we absolutely do need to teach children coping skills so that they know how to cope with life adversity, because adversity is a norm, right? That is the given. It's going to happen at some point in someone's life. So the more that you can teach them coping behaviors, positive coping behaviors, the better off they're going to be. But that doesn't mean that we focus all of our attention on teaching children. We have to create those systems in the first place, right? So that there's safety in the first place. Because the best way that we can do all of this is prevent abuse from happening before it can even begin, right? I just want to make sure, if there are any other questions? Okay, I'm just looking at what we have here in the chat. Let's see. And do I have enough time to talk about this? How am I doing on time?
We're going to have to move on to the next session. Sorry.
Okay, no problem. If anybody has any questions, you can always email me at that email address right there. And I'm happy to answer any questions or any issues that you have. And I'd be happy to share language and things of that nature too. So thank you so much. I hope you all have a wonderful day, and thank you for having me here.
Thank you, Crispin. Everybody is super grateful for your talk in the chat. I'm just going to quickly give a reminder that we're going to drop the workshop survey in the chat, as well as the CEU form. So make sure to fill that out before our next session. And we have one more session left virtually, and we're looking forward to seeing you all there. So thank you again, Crispin, and everybody who has joined this session. Everybody stay safe, and this will be recorded and posted in the future.